We're now continuing with our muscle tissue with the axial and appendicular skeleton muscles. And now we're talking about the muscles of the vertebral column for section 4 of chapter 11. You should be able to, after going through this fairly brief section, the name and describe the three groups of erector spinae muscles, also known as the spinal erectors. Describe the actions of the transverso spinalis and the quadratus lumborum. Simply say quadratus lumborum muscles. So the erector spinae, and as a group, they're all called the erector spinae, and of course you should know them at least individually in terms of their basic location. But their primary job is to maintain upright posture, of your spine. If bilaterally contracted on both sides, the vertebral column extends, so you get spinal extension. So you go into extension if that happens. If they're unilaterally contracted only on one side, either left or right, you'll get lateral flexion in that direction. It looks like a side bend. A lot of people think that's your obliques that do that, and it's not your obliques that do that. That is your erector spinae. It's a back exercise. It's not an abdominal exercise. Three groups of erector spinae muscles when doing it as an exercise as opposed to normal function. The three groups of erector spinae muscles listed lateral to medial from outside in, iliocostalis group, or the longissimus group, and the spinalis group. Other muscles of the vertebral column, we have our transversal spinalis muscles. They connect and stabilize the vertebrae, and also means really you're not really controlling a lot with them, specifically more deep muscles. They're deep to the erector spinae. And the quadratus lumborum muscles, they extend the vertebral column. They perform a spinal extension when they're bilaterally contracted, and they laterally flex the column when unilaterally contracted. Very similar to the other erector spinae muscles, I should say. And they're located primarily in the lumbar region, though. So we're really talking about lumbar motion here for bilateral contraction for going into extension of the lumbar spine and lateral flexion of the lumbar spine. And then take a look where they are, which again, for our exam, you will not have any locations of which muscle is that. We may have a couple of joint areas where we have to break down a little bit what's going on, but I'll let you know in advance of that. But certainly for lab, you'll have to know a lot of these. So we're looking at here are deep on this, on the technically the left side posterior and the right side posterior, even deeper down. The deep side muscles, or muscles that are more deep, or that are deep, longissimus capitis here, and then we have our splenius capitis. We have our serratus posterior superior here, our external intercostals here, and our splenius cervicis here, where it's going to extend up there from there. And we have all of our erector spinae here, which actually travel all throughout that little spinal region, but we're showing them more specifically, more mid to low thoracic region at the moment here. It's where they're showing them from. They're going to extend all the way from your pelvis upward here. Your erector spinae have your iliocostalis group. We have our longissimus group and our spinalis group, and then they go down from there. Then we have our serratus posterior inferior, more the lower ribs, and the lower rib region, and they have our external oblique cut here. Okay, the external oblique actually is responsible for contralateral rotation, so the opposing side. Then up our deeper muscles, our semispinalis capitis here, our semispinalis cervicis. We have our semispinalis thoracis, the thoracic spinal region. This being cervical, thoracic, and then lumbar here, right? Multifidus, single, there are a lot of these, so we call them multifidae, and quadratus lumborum here in the lumbar region, again, more for lumbar flexion, lumbar spinal flexion on one unilateral side or unilaterally, and then when performing bilaterally, it goes into extension. So which muscles form the erector spinae, and what are the general actions of the erector spinae is something you should be able to answer. Let's go on to section 11.5, muscles of respiration. You should be able to list the posterior and anterior thoracic muscle groups involved in respiration and describe their actions. Describe the role of the diaphragm in breathing and in raising intra-abdominal pressure. For respiration, the process for respiration involves inspiration, breathing in, and expiration, breathing out. During inspiration, several muscles contract to increase the size of the thoracic cavity, which allow your lungs to fill with air. During expiration, when you breathe out, some respiratory muscles contract and others relax, which decreases the size of the thoracic cavity and forces air out of the lungs. As far as the muscles of respiration, they're found in the posterior and the anterior thorax, like mid region, right, of the axial spine there. Serratus posterior superior, or serratus, some would say, elevates ribs during forced inspiration. So when it's not natural breathing, when you're forcing it or in times of significant stress, you'd see this. You'd see the actual rising of the ribs. Increases lateral dimensions of thorax. The serratus posterior inferior depresses the ribs during forced expiration. And the scalene muscles, which are up again more in that neck region, help elevate the first and second ribs during forced inspiration. Okay. The external intercostals elevate the ribs during inspiration. Again, another one you're breathing in, expanding the cavity. The internal intercostals are deep to the external intercostals. Their fibers at right angles to the external intercostals, so going opposite, right? And they depress the ribs during forced expiration. And transversus thoracis depresses the ribs during forced expiration as well. So here we have our external intercostals, our scalene muscles, our internal intercostals, more medial, and external more lateral, in this depiction here from the anterior viewpoint anyway. That said, internal intercostals is going to be a little more deep, just slightly. The transverse thoracis here, and our diaphragm here. As far as the diaphragm goes, it's an internally placed dome-shaped muscle that partitions the thoracic and the abdominal cavities. It's the most important muscle associated with breathing. You'll often hear people talk about having more relaxed breathing. We don't see as much rise and fall of all the skeletal muscles that play a role with forced inspiration or expiration. Ideally, diaphragmatic breathing is during times of more low stress or natural breathing. So if someone's able to get to diaphragmatic breathing, then they're going to be technically more relaxed or less stressed from a skeletal muscle standpoint, which should overall help with stress in general. Muscle fibers converge toward the fibrous central tendon with the diaphragm. It contracts during inspiration when you breathe in, and the central tendon is pulled inferiorly, increasing the dimension of the thoracic cavity. So here we have the sternum here, the breastplate. Get a little closer look here. Our sternum here, the breastplate, and then from the lateral view here, we have our external intercostals. And then we have the internal intercostals here, going this pathway. Then we have over here the diaphragm inferior view from below, right? We have the sternum, so you're looking from underneath, and this being the posterior, obviously the anterior here of the body, right? The sternum here, the breastplate, then we have the xiphoid process, the very distal end there of that sternum, and the costal cartilage here, and then you have the caval or caval opening. Then we have the central tendon of the diaphragm here, an esophageal or esophageal opening, the aortic opening, and also called the hiatus. Our 12th rib, our lowest rib, right crus or right crus, all depending on your accent, right here. Of course, that being the spine, L3, L2, and L1, the first of the three lumbar vertebrae. And the left crus here, or crus there, and the quadratus lumborum muscle is cut here. And our psoas major, which actually is both technically a core, so to speak, muscle, as well as a lower body muscle playing a role with flexion of the hip and some rotation of the hip externally. So you should be able to compare the actions of the external intercostals and the internal intercostals and note how the diaphragm is involved in respiration. And we're going to come back to muscles of the abdominal wall in our next section.